Chapter 3 discusses the motor speech examination and everything that goes into it. The guidelines for an examination are history, identification of salient speech features, and identification of confirmatory signs. What is a history? A history reveals information about the onset and course of the problem, the patient's awareness and observations of the problem or disorder, and how it's impacting the person's life. The most important part of a history is getting to know the patient. By asking the right questions, you're letting the patient know you care about them and are interested in them as a person. It's also important to tell the patient the purpose and procedures of the exam. It's important not to rush this. Other aspects discussed in a history are associated deficits, consequences of the disorder, and management. Collecting history is important because 90% of neurologic diagnosis depends on the patient's history. Experienced clinicians usually reach a diagnosis by the time greetings have been exchanged and a history is taken. During an examination of the speech mechanism during non-speech activities, we are looking at the jaw, face, tongue, velopharynx, and larynx, and provide information about size, strength, symmetry, range, tone, steadiness, speed, and accuracy. We also look at respiration. Observations are made at rest, during a sustained posture, during movement, and reflexes. As for the assessment of perceptual speech characteristics, we are looking for the 6 salient features, which are strength, speed, range, steadiness, tone, and accuracy during the tasks of vowel prolongation, alternating motion rates, sequential motion rates, contextual speech, stressing testing, and assessing motor speech planning and programming capacity. There are a lot of components in the motor speech examination, but it's essential for us as SLPAs to know how the process works and also know how to perform the process.